If you've ever wondered what type of lung surgeries are possible in terms of how much lung to remove, it's a very common question from patients and providers alike. Not all lung surgery is the same. We can remove as little as necessary sometimes, but there are cases where we have to remove a large portion of somebody's lung to do a proper lung cancer surgery. We often use drawings in the office that we handwrite as we discuss this to illustrate more or less the relationship of the target lesion or the tumor in the patient's lung to understand how much lung is necessary to be removed. Other more recent developments have shown that not always more is better, meaning there are cases of lung cancer that we could remove perhaps much less lung, called a wedge resection or a segmental resection. That means it's taking out the whole lung or the whole lobe that contains the tumor. We could in some cases remove a smaller portion, maybe as little as 5 or 10% of the lung, as opposed to a larger piece. And this is often preferable for patients who have smaller tumors. Maybe they don't have as much breathing capacity or they're already on oxygen. For people who perhaps are a little more frail or elderly, where minimizing how much lung we can remove can be beneficial. In terms of the type of lung surgeries that we can perform, we can do sometimes what's called a wedge resection, which is the small section of the lung. We can do a segmentectomy, which means removing the anatomical segment that contains the tumor. There are 10 segments on the right side. There are 8 segments on the left lung. So depending on where the tumor is, we can remove one or more of those segments. And the more common operation for lung cancer is called a lobectomy. We have 3 lobes on the right side, 2 lobes on the left side. So the more complete cancer operation is remove the lobe. For example, if I have a tumor in the upper part of my right lung, the more complete operation to be to do the right upper lobe removal, called lobectomy. The word ectomy means removal that portion of organ or the body. So in this drawing, I have a little illustration of someone's anatomy. So looking directly at the person, you can see the right side here. The right lung has 3 lobes, upper, middle, and lower lobes. On the left side, we have 2 lobes, upper and lower only. So we have 8 segments on the left lung, 10 segments on the right lung. So if, for example, if we have this patient with a little tumor in this location in the left upper lobe here, there's 3 operations that we could do. We could do a wedge resection where we come across in this little area. Okay. We could do a segmentectomy where we come across here and remove the lingular segment, which is basically cutting across the bronchus, the artery, and the vein draining this segment. Or we could go a little bit deeper and cut here and do a lobectomy. We will remove the entire left upper lung. So that allows us to get rid of more lymph nodes which live in the neighborhoods around the windpipes or the bronchi. And as a more extreme surgery, in often cases, larger tumors, we rarely anymore do a pneumonectomy, which means remove the entire lung. So that allows us to remove all the disease, but it leaves somebody with only the right lung, which is possible to live like this, but only in people with normal lung capacity. So we do maybe less than 1 complete lung removal or pneumonectomy a year because it's so often unnecessary. So that's typically the options for treating a lung cancer in terms of the amount of lung removed. Sometimes doing less is less invasive, like a wedge, but it has a higher chance of the tumor coming back somewhere along the edges. So sometimes taking a little bit more, like an anatomical segment or segmentectomy, gives us more margin, more distance from the tumor. In larger tumors, say for example, a tumor that's a little bit larger and more central, it's better to always go a little further in where we can remove more of the lung to make sure that we have clearance of all the disease. Oftentimes when we take out this lobe, you'll see that there'll be a missing piece or an empty space, because if you come across here and we remove the upper lobe, for example, then we'll have a little section. This is be closed off here, the bronchus, and then the upper lobe basically be removed here. So you have this section on the top of the space of the chest cavity that will be empty, but over time, this lung will expand further and fill this space to the point that we'll have more room for that lower lobe to expand and fill the space over time. So patients will lose typically 10 to 15% of the breathing capacity by removing an entire lobe. That obviously is where it comes to play. To remove less may be more beneficial.